Yeah, about a year and a half ago, we became involved with brain mapping, which is a technique for looking at the brainwave activity in the clients. And we begin by exploring before, when they first come, and then after 30 days of holistic treatment, we look to see if there are changes in the brainwave patterns. And they show up very clearly on our software, and so we share this with the client as evidence, scientific-based evidence that they have actually changed in their behaviors as seen in the brainwave patterns. We do this in the within the first few days that they come. We sit in here, and for about 15 minutes we do a recording of their brainwave patterns, and then there's no more brainwave activity monitoring until 30 days later when they're about to leave, and then we look at the two, always a before and an after, and we compare the two just to see what changes have happened in the brain as a result of the holistic program. Well, this brings, maybe you could say, the other side of the equation. One side is energy, diffuse energy, not so easily analyzed scientifically. This is very scientifically based. This is evidence that comes from neurology and neuropsychology. So it helps confirm and validate what the other experiences are also. It brings the two together. It helps give us a picture, it helps the client have a picture of what actually changed in their physiology that's very verifiable. This is done with a non-invasive program called NeuroGuide Brainwave Pattern Analysis, and we just put basically looks like a shower cap on the person's head, and it allows us to monitor 19 different aspects of the brain, and it translates back into the computer and creates an image that is compared to the normal. So the color is a real important key to us. Red means extra energy, high energy, too much energy. Blue means too little energy. Green is the normative sample, and this was based on about 2,000 people in a non-clinical population. And so we're trying to move people away from this very extreme area where the red is. This is 2 standard deviations faster, hotter than normal, down to an area where it's within normal limits. And this is not uncommon for our clients. The before and after, for many of our people, we see a dramatic change in their brainwave patterns over 30 days. It's actually true. In 30 days you can change your brain. In fact, you can change your brain much more quickly than that with certain activities, without using substances and without using negative behaviors. The changes that happen as a result of a number of things. If a person begins to meditate and just begins that practice twice a day, we begin to see immediate changes in brainwave patterns. And this has been well established with the Transcendental Meditation Program, for instance. They initially found that there were definite changes in brainwaves within a few days. And so we include meditation here, as well as yoga, as well as diet, as well as exercise, all of which changed brainwave patterns. Well, it helps them, for one thing, to understand that the changes are actually based in their physiology. All of our activities in our whole body-mind are based in brainwave activities of some sort or the other. And when those are diffuse and chaotic, the person cannot settle down, they cannot become comfortable in their own skin, and often they resort to some sort of substance or behavior disorder to try to deal with this diffuse activity in their brain. Once that settles down and they can relax and become more calm and more focused and more integrated, they have much greater opportunity to stop using the activities or substances that they were the victim of before. It is becoming more and more accepted, and people really respond positively to this because they want evidence-based information that says something in me, in fact, has changed. I feel it. This is evidence that it's not just a feeling, that it's actually in real time in their real EEG patterns. And this is very validating for our clients and for us as staff, just to see that something really is changing in the person's body, not just in their energy field, but in their body itself. And that's very validating. No, there are not very many places that do this, actually. This is actually cutting-edge research with brainwave activities. It's called quantitative EEGs, QEEGs, And this is becoming a buzzword in the neuropsychology, and not many recovery programs have taken advantage of this just yet. Ours is kind of a leading edge program. What excites me is that we don't have to focus on the brain to change the brain. We focus on the whole individual, the whole person. And as a result of these kind of practices, and their brain does change, and it can be a permanent, long-lasting change. This is not just a temporary change. It's a whole change in brain state, and this can be long-lasting for the rest of their lives.